Well, we know that about 1 out of every 2 patients with heart failure is considered frail. And if you are frail, that's associated with worse outcomes such as death, hospitalization, and poor quality of life. But we don't know what is causing frailty and heart failure and what kind of markers in the blood track with frailty and heart failure. So in this study, we brought in 113 patients with heart failure into our lab, and we performed an assessment of frailty, including a question about unintentional weight loss over the past year, measure of weakness using chair stands, gait speed to assess slowness, and questionnaires to assess fatigue and low physical activity. We also asked them to provide a fasting blood sample, and we stored this blood until we were able to measure the biomarkers. We chose 8 biomarkers that reflect various pathophysiological mechanisms common in heart failure, including neurohormonal activation, inflammation, insulin resistance, and skeletal muscle dysfunction. So we found that about 42% of patients were considered frail, and that after adjusting for a few factors, including survival score, comorbidities, sex, and a few body composition metrics, that frailty was associated with significantly reduced adiponectin, which is a marker of adipose tissue dysfunction, decreased myostatin, a marker of skeletal muscle dysfunction, and decreased IGF-1 or insulin-like growth factor 1, which is a marker of catabolism. But none of the other factors were significant, which means that frailty and heart failure might be particularly composed of extracardiac factors, namely adipose tissue and skeletal muscle dysfunction. So these pathophysiologic mechanisms may play a role in the mechanisms of frailty and heart failure. And one important thing to note is that these markers were only significant for men compared with women, as when we did a sex stratified analysis, they were only significant for men. So in sum, we provided some evidence of some potential biomarkers of frailty and heart failure.